Hi everyone, welcome back for another presentation. Today we'll be talking about managing overwhelming emotions. Please let us know what you learned from today's presentation by leaving us a comment down below. Now without further ado, I'd like to present to you a social worker and therapist, Araceli Rodriguez.
Hi, my name is Araceli Rodriguez. I'm a licensed clinical social worker. I've been in the field for over 8 years. I do have my own private practice, and I'm also a medical social worker for Kaiser Permanente. Today, I am going to be talking about managing overwhelming emotions. So, first, I want you to imagine yourself in any of these situations. Your physician has just told you that you've been diagnosed with cancer. You're struggling with worsening symptoms of another chronic condition, such as arthritis or chronic kidney disease. Or there's been a big change in your work or personal life, such as a layoff or a divorce. Now, I know for many of you, you don't need to imagine this because you are the one diagnosed with cancer or a family member's diagnosed with cancer. So you have had a big significant change in your everyday. When you are faced with a big change in your life, such as a diagnosis of cancer, what is your reaction? What is it that you're feeling? How are you feeling? Are you angry? Are you sad? Are you grieving? Are you feeling frustrated and under so much stress? Are you feeling anxious or a little depressed? Right? All these things kind of come to you in a wave of emotions. A lot of the times, it's very overwhelming for any of us to feel all these emotions. These overwhelming emotions are normal and they can happen to anyone faced with a life changing situation. Okay. Learning to live with a chronic condition or other big change in your life is extremely stressful. The good news is that you can take control of these situations and manage your overwhelming feelings by making and completing a personal action plan. So, when you are feeling very overwhelmed, you're probably even thinking, well, how can I even manage these overwhelming emotions? They just feel so big, so heavy. A personal action plan can help you take control of the areas of your life that affect how you react to and manage overwhelming emotions. These include caring for your mental health, using relaxation skills, doing physical activity, and eating healthy. By doing these things, this can be a part of your action plan that can really help reduce the overwhelming feelings of all the anxieties, all the stressors, all the depressive symptoms that you might be feeling. When you are trying to control the overwhelming emotions, you need to create something called a personal action plan. So, by creating a personal action plan, you're going to be able to reduce the level of stress. So, what is an action plan? An action plan is a short term plan that can help you reach a goal, such as taking control of your overwhelming emotions. Okay? They include a specific action or behavior that you want to do and know that you will be able to accomplish it. Okay? In order to do an action plan, you must answer these following questions, okay? What are you going to do? How much are you going to do? When are you going to do it? And how many days of the week are you going to do it? If you are unable to answer any of these four questions, it's gonna be very difficult for you to create a concrete action plan that is actually achievable. Okay? And a personal action plan can be used in many areas of your life. I want to make sure that you identify what your goal is. Okay, so your goal could be to control and manage your overwhelming emotions. It could be to decrease my crying spells from 5 times a week to 2 times a week. It could be to reduce the amount of ruminating thoughts or anxiety symptoms that I feel at night from 5 times a week to 3 times a week. Okay. I want to explore looking at it a little bit more closely as far as taking care of your mental health. So, in taking care of your mental health, what is it that you're going to do? I will, make sure that you make an appointment with your doctor to learn more about cancer and talk about the concerns and feelings that I've had lately. Whether it's about the side effects about a medication, whether it's about some of the symptoms that might I might experience later down the road. Take a class that deals with stress management, depression, or managing cancer symptoms. Maybe it's making an appointment with a dietitian so you can really know what it is you need to be eating, what foods to avoid. Talk it out. Make sure that you have somebody, use your support system to deal with the stress management, with the frustrations that you're experiencing, to be able to share that with those close to you. To take care of my mental health, I'll try and decrease the negative self talk that I do with myself. Set aside time for problem solving early on in the day, so in the nighttime when you go to sleep, you can stop worrying about everything. And to decrease that to do list that's kind of going in your mind over and over again. So an action plan sample could be, this week I will write down any negative feelings that I say about myself and change them to positive things. You need to be very specific in your action plan in order for it to work, okay? So you can say, I'm going to change my negative self-talk to positive self-talk for 15 minutes, right before going to sleep, every Monday, Wednesday, Friday, or every Saturday and Sunday, or Tuesday, Thursday. The more specific you are with your action plan, the more concrete it is, and the easier it's going to feel to actually accomplish. Another action plan that you can do to be able to help control the overwhelming emotions is to create an action plan that can make you feel more relaxed and less stressed. So in order to do this, you can laugh and appreciate the humorous situations when they come up. So keep an emergency laughter kit that contains funny movies, books, cartoon, pictures of your children, pictures of your pets that automatically make you smile. Practice some deep breathing exercises. For that you really do need to inhale deeply through the nose and really filling those lungs with air, and exhale very slowly through your lips. Okay, go very, very slowly for the breathing exercises. Listen to gentle meditation music, guided imagery, anything that can really quiet down the mind as well as the body. Take a warm bath, read a book, do a relaxing activity like yoga right before bed. So an action plan could be, this week I'm going to take 3 deep breaths at least 2 times a week right before I go to my doctor's office, because I know that makes me anxious. When you're battling any type of chronic condition, or when you're battling cancer, your diet's going to have to change a little bit. And so you can also create an action plan to eat healthier. So in order to do that, you can eat healthy meals that include plenty of fruits, vegetables, whole grains. Be prepared by bringing healthy snacks to any event that you go to. Maybe it's putting them in your purse. A couple snacks just to keep it handy. Have meals prepared already in your refrigerator, because if you already have it, you're gonna decrease the amount of snacks that you take because you're hungry right here and now. And so in order to continue your action plan of eating healthier, just make it very easy, very standard. This week I'll bring fruit to work and eat 1 apple during lunch break every single Monday. So when you do that, you already know how many, what day, which fruit you're going to take. So the more concrete again you are, the easier it's going to be to accomplish that goal. Hopefully, with the examples that I just provided, you would have already heard it in your head that what I really want you to pay close attention to is that your action plan really needs to be very concrete. That way it makes it a lot easier to follow. So it is as simple as, this week I will what, how much, and when. You can use the sentence for any type of action plan. So this week I will what? I will eat how many, how much, 2 apples, when? Every Tuesday and Friday. This week I will eat 2 bananas every Friday afternoon. This week I will walk for 30 minutes every Tuesday. This week I will write in my journal every night before I go to bed, Monday through Friday. The more concrete you are, the better. So using this phrase, this week I will what, how much, and when, it's going to make the world a difference. It's going to really simplify every single action plan that you create for yourself. You can really create your action plan for mental health activities, relaxation techniques, physical activity, eating healthy habits, managing side effects of the medication that you're currently taking. So you can really utilize an action plan for every aspect in your life. In creating realistic action plans, you really need to be able to feel extremely confident that you will be able to accomplish your goal. Okay. So, when creating your action plan, really ask yourself the question of how certain you are that you will succeed with your entire action plan. If it feels very overwhelming, you might want to break down that plan to a little bit more concrete action steps. So, sizing down that goal. If you ask yourself, how confident is it that you're going to accomplish your goal? If a confidence level is of 7 or more, then that's really good. It means that it's very realistic. If your answer is not at least a 7, think about adjusting your action plan a little bit. So, like, let's say you've never walked in 5 years, and all of a sudden you want to walk for an hour every single day. If that seems very daunting, if it seems very overwhelming, you might want to scale down to maybe walking 15 minutes a day for 3 days, and then slowly incrementing that to 30 minutes every 5 days, and then you can work your way up. So make sure that your goal is not too overwhelming, because if it feels very overwhelming, the likelihood of you accomplishing it or even wanting to start it is going to be very slim. So make sure that it's very realistic and that you feel very confident that you're going to be to accomplish that goal. So in a scale from 1 to 10, ask yourself how confident you are that you're going to accomplish it. If it's a 7 and above, that's great, fantastic, do it. If you don't feel like you're at a 7, if you're like at a 4 or 3, you might need to scale down your action plan. So everything that we reviewed, everything that we went through, will hopefully be able to decrease the overwhelming emotions that you're experiencing with the cancer diagnosis or any other chronic condition. However, sometimes even with practicing relaxation techniques, even with eating right, being physically active, having a great support system, is still not enough to manage your overwhelming emotions. Then, at that point, it might be a little bit more severe, and you might feel like the symptoms of depression or anxiety are extremely overwhelming, and no matter what you do, how many times you do it, you're still not feeling better. If that's the case and you feel like the symptoms are increasing, where you feel very overwhelmed, very stressed, like depression and anxiety, you should contact your physician just to make sure that your safety is not at risk. We just want to make sure that you're doing okay. So you can do absolutely everything right and have like the most amazing action plans that they're very achievable, and you're actually doing them and you're accomplishing them, and you still don't feel right. If that's the case, do contact your provider, because there might be another treatment plan that they recommend in order to manage those overwhelming emotions. Okay, thank you.
Thank you so much, Araceli. We really appreciate you being here today. And thank you to all who were able to tune in today and watch this video. Hope this information was beneficial to everyone. Don't forget to leave us a comment down below to let us know what you learned today. And also don't forget to follow us on our social media pages, our Facebook and our Instagram, both at the Pink Ribbon Plays, to be updated on future presentations, program updates, and other educational content.